Great. So welcome everybody to our Caring for Undocumented Student Wellness and Mental Health Promising Practice Roundtable. Thank you all for the patience as we rescheduled this event. Also had some tech difficulties with the message, so apologies also for the confusion. It's been a tough December, so hopefully we're ending the week in a better space, but really glad to kind of see some familiar faces and also new faces as well. And so if you have not joined us before, these are our statewide Promising Practice Roundtable for California educators. We do these virtual gatherings every month. This semester was a little different as our organization and our team went through some transitions, but these are spaces for practitioners like yourself to get connected with each other, promote cross-campus and organizational learnings, and just build solutions to common challenges together. And before we kind of get started with our topic for today, please continue to introduce yourself in the chat if you haven't gotten the chance to do that. I do just want to do some quick updates and just refreshers given everything that's been happening in the last few months. And also if I could ask folks to mute themselves if they're not speaking. I think I'm hearing a little bit of feedback. But just wanted to open up the space first with some post-election resources if folks have not been able to see that yet. We have, and we'll be sharing the slides so folks will get access to these links. We have the President's Alliance, 5 Ways Campuses Can Support Non-Citizen Students and Employees Post-Election. This is a national guide with tangible strategies and examples to kind of help campus leaders prepare their community for the next year. So this includes things around like releasing supportive statements, hosting Know Your Rights workshop, uplifting legal services, and strengthening and promoting campus and privacy protections. And then we also have something from My Undocumented Life. They release an open letter to undocumented communities and allies that shares more of that affirmative messaging, resources for undocumented communities, and practices for campus personnel and administrators to increase their support. We won't share these links in the chat now, but again, folks can kind of check these out as we share the slides later. And then also just want to refresh people too on a couple of our Immigrants Rising resources that might be helpful, especially during this time. This one, maybe I'll ask Ugo to actually put in the chat this first link. We have this, there's been a lot of questions around student privacy and protection, right? And so we do have this Protecting Student Data in California resource that talks specifically about federal and state policies that safeguard student information and access to educational, like public facilities here in California. This can help kind of create policies for you and your campuses, right, on how to deal with immigration enforcement, for example, or how to protect student information, especially as it relates to financial aid. There's also updated guidance from public higher ed systems included on here, and we are actually actively updating this resource because a lot more things have been coming up in the last month, but it'll be the same link to access this. Please share this too, as I think this can help answer what campuses can do, right, to protect undocumented students in the coming year that we have. Another classic, but still helpful resource that we have is our top 10 ways to support undocumented students, which again, just kind of includes practices and resources. I think is and it's especially important now to like empower and equip undocumented students in their educational journey. There's a ton of uncertainty, right, that we're dealing with in the new year. And fears are definitely make sense, but I think there's a way that we can also kind of like have talked to our students coming from a place of power rather than fear to still pursue opportunities, especially here in California, regardless of what is coming for us, and also find support for them. And then lastly, also been lots of questions, right, around financial aid. As folks know, the California DREAM Act and FAFSA did open later this year and opened in December 1. And there's just been lots of questions, especially around information privacy for mixed status families. I do want to, excuse me. clicked on the wrong thing. I do want to share that we have gotten a lot of messaging that the CADA information is especially protected. CSAC did release this student memo that outlines what those protections are, reaffirms their commitment, and shares some resources to support students in applying. And I think paired with that message, I do see a lot of drop in undocumented student enrollment in general this upcoming year. So also really want folks to think about how they can help undocumented students understand that college continues to be accessible to them and there are resources and support available. Future concerns are always very valid for undocumented folks, and the post-grad pathway is not always as straightforward for undocumented students, but those options are available, and it's still worth it, I think, for them to pursue college for the skills and networks that'll open up for them. And then I do want to share that we're still actively kind of like working with what's happening with FAFSA. FAFSA guidance is still a little bit less clear. There are existing protections you can read about in this President's Alliance resource that talks about data protections that exist for FAFSA right now. And there's also specific guidance from CSAC around what to do for mixed status families. The California DREAM Act for mixed status families is another option for them to consider this year, to maybe fill out now and do FAFSA later, as we kind of learn what's going on with that application. And so also kind of suggest folks kind of keep updated with some of what we're releasing around that, what we're seeing out in the field, so students and families can kind of like make an informed decision based on what's known today, and what will be, and we'll also kind of update folks as we move forward into the new year around that. I also won't have a lot of chance, because that's not the topic of our discussion today, to talk a lot about financial aid applications, but do want to share this specific webinar that we're co-hosting tomorrow with SoCal CAN and First Gen Empower around advising undocumented students and mixed status families, especially around financial aid in college. It'll be taking place at 11 a.m. to 12:30 p.m. and folks can have more time to answer questions in that space. And I know this is a lot to kind of deal with, lots of different things that are unknowns, lots of like questions I think that is coming up for folks who are supporting undocumented students and their families. So I do really want to leave folks with this message that I know anchors a lot of our work here at Immigrants Rising. And it just reads, undocumented, you're not alone, we're in this together. And this is also a message I want to share with you all as we kind of move forward in this new year, right? Like, that you are not alone in this work. You don't have to have all the answers. There are folks out here who are supporting you. You're part of a dedicated network of champions by being here in this space and being part of Immigrants Rising. And we are here to support you and the families and students that you work with as well. And so I think with that, there's lots of different information. So I think before we dive into our topic of discussion today for mental health, I'm just going to take a 1-minute pause. If you want to take a quick breath or stretch, there's this little like breathing video we can follow along if needed. So I'll just do that. Great. Great. Thank you all for that, for also just having that part with me. And so I'll pass I'll get us started just with our agenda. We're doing our welcome and updates right now. I realize I completely forgot to introduce myself, so we'll do that in the next slide. But we'll do a check-in question as well to kind of ground us in the space. Then we'll kind of reiterate just the value of caring for undocumented mental health before kicking off our panel with some amazing panelists doing great work on their campus today. We'll give folks a chance to kind of reflect on the information shared today with during our Building Collective Solutions portion, and then we'll kind of close the space after that. And so I'm going to pass it to my colleague in a minute, but also just wanted to name, if you have not met me yet, my name is Madeline Villanueva, she, her pronouns, and there's been some transitions in our team since the last time we held our Promising Practice Roundtable. So I'm now currently Interim Director of Higher Education. And then I'll pass it over to my colleague Ugo to do this opening activity for us.
Hi, thank you, Madeline. Hello, thank you, and hi, everyone. So yes, my name is Hugo Lopez, he, him, his pronouns, and I'm a programs coordinator here with Immigrants Rising. And so folks may continue to share your name, pronouns, position, and campus organization in the chat. And let's also do a quick check-in question that we have on the screen here. So if folks would share in the Slido, so you can go to slido.com and the code is right there on the screen, or you can scan the QR code. And the question is, what are some challenges in connecting undocumented students with mental health support? So if folks could share that on the page. Let's see. So folks can scan the QR code that's shown on the screen, or they can go to slido.com. There it's coming up on the screen. We'll see how folks are feeling about the question here. What folks are sharing. Okay, fear, yes. Stigma. Fear of judgment, yes. Cultural stigmas, cost of services, exposure, cost and access to mental health providers. Yeah, some big ones are coming up. Stigma, cost, vulnerability. We're seeing patterns here. Lack of culturally sensitive therapists. Challenge is being able to identify. Well, I missed it. But yeah, we're seeing a pattern. Oh, thank you. The challenge is being able to identify them on campus to be able to offer support. Yes, so some folks are still not able to share about their status openly, still remaining in the shadows. A lot of us know what that's like. Sharing their legal status, once again, not wanting to pressure an undocumented student and sharing in case they are not open yet. Yes. So I think some patterns begin to emerge as we look at the different experiences that folks are sharing. Yes. Language barrier, lack of bilingual mental health providers, not enough providers, fear and stigma from family and not trusting institutions, lack of culturally competent services. Yeah, thank you folks for sharing about all of this. Mistrust of systems. Absolutely. The students are used to being hyper independent and feel they have to figure things out on their own. Yep. That's for sure. Geographic access. Yes. Yeah, folks can feel free to also comment on the chat and react. If you haven't yet introduced yourself, go ahead and do that. But also you may react to what is being shared. Limited sessions are offered by mental health providers that accept Medi-Cal or on campus. Yeah. The fear of sharing too much information that will get them reported. Culturally sensitive professionals, some big ones, yeah. The process of finding a therapist, if interested, it can take time and feel discouraging. Yeah, absolutely. Like I mentioned, we see patterns starting to emerge, some commonality among the sharings, intersectional challenges, process of finding a therapist. Oh yeah, we read that already. Yeah. Thank you, folks, for sharing and also for introducing yourselves in the chat. Um, yeah, so folks may continue to share on the Slido by following uh, the QR code or going to slido.com and entering the code. I think at this point, I can pass it back to, oh, no, hang on a second. If folks would feel like sharing out a little bit more about maybe reactions to what was just shared on the screen in the Slido, um, we can have a couple of folks maybe share out just a reaction or just to expand a little bit on what was shared. We have a couple minutes to do that. Would anyone like to share out?
Yeah, feel free to unmute yourself or put it in the chat. Any resonance with what folks are sharing, any things you just want to highlight based on what you're seeing, right? If anyone wants to talk more about what they included on here.
Hi, Madeline. I can share. Uh,
Great.
so I think I'll use myself as an example. So I'm a student, a PhD student at Claremont Graduate University, which is a private institution, and there's lack of awareness and advocacy from institutional admin. So I think part of the issue of the challenges is we can think about connecting undocumented students to mental health support, but if that institution, unlike the UC system, that they have a huge UC ship network, if there's a private institution, they don't have where to refer them to or where to connect them to, that's a challenge. And because of the lack of awareness, they don't know what's offered around the community. Like they didn't know about Immigrants Rising. Like if you don't know about Immigrants Rising, that's a problem. So yeah, I think that's part of the issue.
Yeah, thank you, Christian. So it sounds like the cultural competency, right, to just work with undocumented students could be missing, and even just an awareness of existing resources that does support undocumented folks. Right. We'd love to hear maybe from one more person, any resonance, any differences as well too.
I can share a little bit. I think I'm a bit of an outlier here. I know about Immigrant Rising because I'm originally from LA. I'm originally from California, but I now live in Cincinnati, Ohio, and I've been here maybe about 3 years. Um, and I am the director of the Student Health and Services, Health and Wellness Services at Art Academy of Cincinnati. And there's been no mention of or any kind of consideration to undocumented students and how now with like the results of this election, what that's going to mean for any undocumented students, current and or like possible incoming students. So I think just the fact that it's not even a part of the conversation at all. And so I'm going out of my way to tap into the resources that I know are out there um, back home in California, that I know some of the information you share is more specific to like California and California institutions and laws, but the fact that you share some national ones I find really useful. So thank you.
Yeah. Thank you, Sylvia, for sharing that too, right? Yeah, so even I think to Christian's point, the lack of awareness about undocumented students, that they're not even part of that conversation, right? Is really a barrier in providing just that support, even if practitioners don't know that those students exist, yeah. And then I know there's a resource that Myra Barragan, who is our colleague, part of our mental health team, that actually shared on the chat. Myra, I don't know if if you're able to come off mute to talk quickly about that. We have that as part of our slides as well, but if you just want to mention that now, that'd be great too.
Hi, sorry about my own presentation, but I wasn't expecting to come off camera or mute or unmute myself, but yes, I just wanted to highlight a couple of resources that Immigrants Rising has. One of them being the Mental Health Connector. So what the Mental Health Connector does, it connects mental health providers. Most of them are either undocumented or have experience working with the undocumented community with undocumented students in California. So if you work with students that may need additional support from a therapist, please let them know that the Mental Health Connector is available to them. We typically start connecting folks at the beginning of the semester, so around the second week, last week of August, and they receive sessions until the last week of May. So these services are free for them, and if for some reason it doesn't work out for them with the first connection, we connect them again. So we still have a few spots left, about, I'm gonna say 10. But like I said, every fall we connect about 100 to 120 people. Even if they're not able to get connected at this moment, we can place them on the wait list. And as soon as we have an available clinician, it doesn't have to be till next fall, we will connect them. Yes, again, a lot of the providers are undocumented themselves or have experience working with the undocumented community, meaning that a lot of them are multicultural, bilingual. However, we don't advertise services in other languages just because we don't want to promise something that we cannot deliver. So we cannot advertise that all of the providers are bilingual in certain languages, just because if somebody who's bilingual in Mandarin wants services in Mandarin and we don't happen to have a volunteer clinician, we won't be able to deliver that. So another thing that I want to highlight that I just mentioned is all of the therapists are volunteers. So if you know of a licensed clinician who would like to volunteer, they can also sign up through us in the same link that I put in the chat, and they can volunteer their services and get connected with an undocumented student. The other service that we have are the wellness support groups. I'm going to put them in the chat as well. But the wellness support groups are closed support groups in which about 10 to 12 people get together. And these groups are for people in the US, not just in California. So I see that Sylvia, you mentioned that you're in Connecticut, if I got it right. So your students can join the wellness support groups. These are 6-week, 1 hour a week support groups. So the same people that folks are going to be seeing in the first session are going to be the same ones that they're seeing throughout the 6 sessions. And the groups are for undocumented API folks, undocumented Black folks, undocumented students. So those specifically who want to talk about their experience of being an undocumented student in higher education, they can join. We have coping with uncertainty, Undocu Love. So we have a lot of different groups. We have 8 at this moment that are gonna be starting in the week of January 20th. So they can start signing up. They fill up pretty fast. So please let your students know that this is a space for them. And although this is not a therapy group, it can be therapeutic and it can be healing for their students being in community with other folks struggling with similar obstacles and feeling similar joys and successes.
Yeah, thank you
Thank you
so
for
much,
that,
Martha.
Madeline.
I know there's probably more questions folks are coming up with as Myra is speaking, so we'll share the link in the chat for that as well. I actually have that covered in one of my slides. But I think as we move on from just kind of like thinking about those challenges, like naming those challenges, seeing what kind of some of the barriers in providing the support, this type of support are for folks. I do want to transition us back into just kind of naming like, why is it important to address, to kind of provide the support for students, and just what are some of those opportunities that could kind of help address some of those challenges before we kind of hear directly from our panelists on how they are addressing potentially some of those challenges as well. So I just have these really quick graphic here, I think that kind of represents, right? I think folks here are aware just of the different stressors and concerns that our undocumented students are facing that really impacts their retention in school, their success in school, even whether they go to school in the first place. And so I think that's really the importance of providing this support, right? So that our students are able to not just really survive in this country, but I think find ways to thrive despite the immigration status. And so not going to go too much into these slides because I feel like we got really a sense of the challenges that folks are facing in providing those support, right? We heard a lot about just stigma and seeking help, stigma and revealing immigration status. There's limited capacity for existing mental health services, that the existing care is not culturally competent, really lack of resources or funding, or just not enough training or not enough support for those supporting undocumented students to really address some of the long-term issues. And so hopefully our panelists will kind of dive more into this, but I do want to just share some opportunities we've seen in the field through Immigrants Rising of how to strengthen this care without having to figure out all of the challenges all at once, right? And so I think part of that is really starting with self and being that safe space for undocumented students. Undocumented students, I think, don't have to reveal their status, right, to receive care. And so I think building that connection and trust and showing yourself as a safe space for undocumented students can help kind of address that stigma in seeking help, can help them understand potentially like what mental health support is, what it isn't, and potentially connect them with services as well. And then I think part of, oh, I'm so sorry about that. I think my things are not working correctly. As Myra was mentioning too, there are already some resources that exist, and I think connecting with community can really be helpful in tending a little bit to undocumented wellness, right? Myra spoke a little bit about our wellness support groups and our mental health connectors, so we'll drop those links in the chat as well. And we do have this really great list put together by our mental health team of just national, state, and local resources around mental health for undocumented people. Another thing to keep an eye on as well, United We Dream does share resources, host regular spaces around mental health as well through their Undocu Health initiative. And also thinking about like not everybody, right, it has a mental health provider to provide services directly on their campus, but potentially we've also seen some campuses actually just host these kind of like non-therapeutic wellness sessions. Sometimes they're called Undocu Talks that are like talking circles to discuss like common experiences within the undocumented community and just build community and support in that space can be helpful to even introduce the idea of like mental health and wellness, right, to undocumented folks. And then I have this kind of long list that I'm hoping that we'll get a chance to kind of dive a little bit deeper on in our panel. But we do also have we've seen some practices around building capacity and leveraging resources in the field as well. We know around cultural competency was a really big challenge, right, that we saw in the Slido. So I think thinking about providing Undocu ally trainings to mental health providers, or our mental health team actually has opened up invitations for their trainings for working with undocumented communities for mental health providers. Really long title, but this could be a space for you to share with current mental health providers in your campus or community if they're hoping to learn more about how to work directly with undocumented communities. Ugo will also throw that in the chat if he hasn't already, but that's a way to kind of increase that cultural competency and awareness for mental health providers already in your community. We talk really a lot about collaborations, right? How do you kind of increase collaborations or partnerships with campus health and wellness centers? I think we have an example for this on our panel, potentially working with other departments to leverage funding to address student mental health needs. Is there a way to kind of think about how to use existing funds to serve specific student populations like undocumented students on your campus? And thinking about what exists out in the community. Is there a way to develop or set up referral services or even identify community partners to provide those mental health services? And so I will actually transition us into our panel because I think we're running a little bit over time. But if folks have questions, feel free to throw it in the chat or hold on to it. We will have a chance to address them as we go along. But hopefully my panelists are here and can go on camera if they're not already. But please welcome Dr. Connie Moreno Yamashiro, the Director of Student Development Engagement at Fullerton College. We also have Areli Castro, the Undocumented Student Services Coordinator at Cal Poly Pomona, and then Dr. Bianca Barrios Montoya, a licensed psychologist with the Undocumented Student Program at UC Berkeley. So I'm gonna stop sharing my screen and hopefully folks are here. And so I'm gonna go ahead and read our first question and then just kind of call on folks to answer each question as we go along. And so first question for everybody will go in the order that I just named everyone. If you'd like to introduce yourself a little bit more, go ahead, but briefly tell us about the mental health and wellness support you provide to undocumented students at your campus. And is this support institutionalized? And so I'll go first with Dr. Moreno Yamashiro, then Areli, then Dr. Barrios.
Good morning, folks. Thank you for having me. Dr. Connie Moreno Yamashiro. I use she, her pronouns. I serve as the Director of Student Development and Engagement at Fullerton College. So I support 4 affinity programs, Grads to Be being one of those programs supporting our undocumented and mixed status students, our Cadena Cultural Center, our LGBTQI2 Spirit Plus resource program, and our Emoja community program supporting our Black and African American students. And so I'm happy to be here and share about the mental health and wellness support offered at Fullerton College. So specifically at our college and our department, we have 3 embedded therapists. And so we have embedded therapists in their Grads to Be program, LGBTQI2 Spirit Plus, and Emoja. So the model really began in fall of 2021, and we had our first embedded therapists with our undocumented and mixed status student community through our Grads to Be program. And so this was the first time where we actually offered affirming care for our students from somebody who identified with the community, and they offer services to our free services to our students in English and in Spanish. And the ways they support our students is twofold. So we have a partnership that I'll share a little bit later with our behavioral health services, which is the office that houses all our therapists on campus. And so they do 16 hours in behavioral health services doing straight therapeutic support. And then they do 10 hours physically in our space where they do non-therapeutic support. And so that looks like a 30-minute check-in, like, how are you? How are things going? Talking about a lot of things folks said earlier, there is a stigma around mental health support. So like, let's just check in, like, let's just ease you into this process. Like, And so they do 30-minute check-ins, Undocu chats. Those happen once a month. We have mental health workshops that they host, and then they do healing spaces. So like when DACA rulings happened, we had healing spaces facilitated by our embedded therapists. They also do mental health social media posts. So Mental Health Monday, Wellness Wednesday, and then, working in higher ed, they attend meetings. And so they attend team meetings and department meetings. And is this supported? Is this institutionalized? Like funding wise, no. But it is supported, and there's a lot of love and care for our undocumented mixed status community. We do prioritize our Dream Resource Liaison funds to fund the hours the embedded therapist works in our office and in our program. We're very fortunate that this year the mental health therapist office funds 100% of it. So that is really helpful to us this year, but normally we split the costs. And so it then doesn't feel like a huge financial burden that we're taking on because we're paying for part of the personnel that is doing this embedded therapist. And then we're also piloting a wellness associate, which they can actually do licensure hours with us. So folks working towards like a MSW, MFT, their license. And so we've been doing a lot of great things, again, just trying to meet our students where they're at. So hopefully that helps.
Yeah, thank you for sharing that, right? I think I heard some solutions you all have tried to destigmatize, I think, mental health support a little bit more on the campus, and also some kind of like leveraging of existing funds to fund the specific position at your campus. And so I'll transition over to Areli for the same question.
Thank you, Madeline. Hi, everyone. Areli Castro, pronouns they, them. I serve as coordinator of Undocumented Student Services at Cal Poly Pomona. And for us, our services with mental health providers, we're still trying to figure out the best way in which we can support our students. I am 1 year into this position, and when I came in, there was a non-existent community. I mean, there was a resource center, and we knew that there were undocumented students on campus, but the undocumented students weren't coming into the space. So we are in the process or on the first phase of creating visibility and making sure that students know that we exist. And of course, the second phase is to start providing services. We already have services and we have partnerships on campus that are allowing us to share and provide resources to our students. One of them is around the same time that I started, like a year ago, there was a CAPS counselor that was hired, and she specifically requested to be our liaison. And I'm very thankful that the director of CAPS services, of counseling services, was open and willing to let her be part of our liaisonship group. So in that partnership, she has been able to assess our needs, and she also has come up with some projects and ideas and events that might be helpful. We noticed that our students, and this might be true around other states and in other California colleges, but our students are really checked out. I don't know if it is because we are entering a new era of social media and internet where our span of attention is this big, or is it just that we're going through election season and students were really checked out, or there's just so much output and input that they're getting in terms of information and news that it is really challenging for students to concentrate on one thing. In addition to the visibility part, right? So part of that conversation that we have with our CAPS liaison was, what are the best things that we can do to start demystifying and destigmatizing mental health? Also, the challenge that we have on our campus is that when students come in, it is very clear that you're entering an undocumented student center. So we're trying to figure out ways in which students feel comfortable coming in without them feeling that they're, outing themselves. So she has a couple of ideas. We're going to continue to do community events. She's done drop-in hours. She was there with us when election day was happening. we put together some events after the election, after the debrief that our legal providers gave to us. She also had a debrief session about, taking care of your mental health. And so we're going little by little. Another thing that we have implemented is a liaisonship with the care center. And similar to what Dr. Moreno mentioned was this intern liaison. She's working on her social work program, so she needs hours. So we're able to house her in our space, and she will be able to be doing drop-in hours and meetings with our students that are able to connect our students to all care center services. So emergency funding, basic needs, food pantry, and beyond. And one of her interests as part of her thesis and project that she wants to work on is mental health visibility and access to her undocumented students. So we're going to be working with her on that. But I think the part of, right, I've been told by the administration, like, we can only fund your position and nothing else, which becomes very challenging, right? Because the promise that I have for on my campus is that I want it to become Undocu friendly, and that means that we need staff that gets paid fairly in order for them to support our students and for me to do a better job at my job. And the last thing that we're doing is, when we do advising, we share the resources that are already available. So like the resources that were shared at the beginning of the presentation, like, we make sure that our students know about Immigrants Rising. We make sure that they know about the scholarship list, that they know about the mental health support, about the groups that are available. Because again, like, a lot of the things that you all mentioned are happening in our campus in terms of like not having competency, cultural support, and also just not having space. I am conducting ally trainings that are tailored to specific departments, meaning that I am talking about the experience of undocumented students and their mental health struggles and stressors, specifically to mental health providers in our campus. And we're doing something similar to the Career Center, which is a completely different ally training that we're working on. So it is a lot of work, but I think it's work that is worth doing. And I feel like I'm forgetting something else, but it will come up to me. So I won't take more time. So I'll allow the other person to share.
Yeah, thank you, Areli. So just some examples, right, of what the destigmatizing mental health can look like. But unfortunately, I think still like the advocacy, I think that also needs to happen to build that capacity within campuses too. So I'll turn it over to Dr. Barrios to go next.
Good morning, everybody. Dr. Bianca Barrios Montoya. I am one of 2 licensed psychologists for the Undocumented Student Program at UC Berkeley. I've been in my position for 5 years, and my colleague, Dr. Diana Peña, she's been in the position for 10 years. And so initially it was just Dr. Peña, and it was a lot for one person. And so, yeah, she advocated for herself, and we were able to get my position. And so now our positions are a little different. She has a coordinator role for the mental health, and then mine is focused on just clinical work. And so then in my role, I do individual therapy, wellness, psychoeducational workshops, support circles, consultation for just the general campus. And my position is funded through the Undocumented Student Program. So I am also a part of the Counseling and Psychological Services, so the University Health Services on campus, but I'm funded through the Undocumented Student Program, and that's funded by a donor. So donor funds mine and Dr. Peña's positions. And so that really allows for us to be flexible in the work that we do. So I do not have to do the things that CAPS psych counselors have to do, right? And so the average amount of sessions that we have for students, so we have unlimited sessions for undocumented students versus the brief model that is available for the general student population. So on average, I see students for about like 15 sessions versus the 2 sessions that CAPS counselors provide. what else? Yeah, and so with the like wellness psychoeducational workshops, it's really like about being proactive. So this semester we had a really big focus on like election related stress. So prior to the election, we had like workshops on like dealing with xenophobia, like yoga and movement for de-stress. We had a few support circles leading up to and after the election. And so, yeah, I am so blessed to be in my role and have the flexibility that I have. Like I've worked with students from when they entered undergrad first year to when they graduate. And that's pretty unusual for Undocu students and just for college students in general. And yeah, and on campus, we have the undocumented student program. And so they're often promoting mental health. And so students mostly feel comfortable seeking services from us. And I'll keep this little part short because I know we have much more to cover.
Yeah, thank you so much for sharing. And I think for just also showing us like the possibilities with unlimited resources, which unfortunately not everybody has, right? But like the potential to build towards that, I think can show that like there is a model that really like supports undocumented students mental health wise that exists. I benefited from that myself actually. Dr. Pena was my therapist when I was a student at Berkeley, and I was glad to have had her during my time there. So thank you for sharing. And so I'll transition us to our next question. I think one of the biggest topics we've just been hearing in this space is around the cultural competency, right? Like there are services available within the campus or community, but they might not be friendly to undocumented students. I know Areli started answering this a little bit already, but wondering folks' ideas on how campuses can ensure cultural competent care for undocumented students. And we'll go with Areli first and then go back to Dr. Barrios.
Yes, thank you. So for us, like I said, I'm very, very thankful that when Cynthia, who's our CAPS liaison, came on board on campus, she was, she wanted to work with our community specifically. She requested to be our liaison, and she had some cultural competency in terms of working with undocumented immigrants. Immigrant folks before she came to Cal Poly Pomona, so that made it very like the transition was very smooth. I didn't have to do a lot of like education for her, but her and I agree that if she's our liaison, she might be the only one that has this experience of supporting undocumented people, even though other CAPS counselors may be able to have some cultural competency in terms of immigration. So that's how we decided that we wanted to invite CAPS counselors and the director of CAPS to attend ally trainings. So we do have one ally training that it's open to the campus community, and it's a two-part training. First part, we talk about the last 20 years in immigration reform that has affected undocumented youth and undocumented students. And then part two is state, local, and campus-based support for our undocumented students. So once they have attended that training, like I mentioned, we are going to be tailoring sessions where we talk about cultural competency as a mental health provider. We're still working on that and making sure that what I'm providing to them and the support that I provide to them is relevant and that it makes sense for them to utilize it in their day-to-day. But it is a big challenge, right? Because I know that, for example, Cynthia is not going to be able to see all of our students. Not all of our students will be interested in accessing mental health support. And that's why we're also trying to collaborate with other campuses, other campus partners. And like I mentioned, the care center, right? Like when I met with our intern Gloria, she was very honest. She said, I have cultural competency from the sense of I was part of a mixed status family, but I haven't served undocumented students or undocumented people directly. So that would be a learning curve. So I was very thankful that she shared that. So I'm able to put together a guide of information that I can share with her about the different stressors, the different challenges that undocumented people face accessing higher education, in addition to, what the national landscape is at the moment. And she was very open to, revise those documents, attend the ally training, and being able to understand and have meetings with me about that. Something that also Dr. Moreno mentioned that she does with her staff, that they get invited to staff meetings. Likewise for us, the CAPS liaison and the care center liaisons are going to be joining our staff meetings, and they're going to be put together in a sort of like a task force slash group, where all the liaisons that are supporting our students can come together once a month, and I'm going to be giving them updates that are relevant to their work, but also for them to meet each other. Because for those of you that have worked in higher education, it can be very silo, right? Like if you're doing cultural work, that's all you're doing, and then academics is somewhere else. So I'm trying to like sort of like bridge that gap and making sure that we all know what we're doing. So in a situation where a student needs academic support but also has a mental health crisis, we're able to close that bridge in an effective way without sending the student to 1,000, offices. And the last part that I'm doing with the support of the Division of Student Affairs is needs assessment. So a basic needs assessment. And in the questions that I'm asking, we broke it down into 3 categories. One is sense of belonging, access to resources, and experience on campus in terms of like just as a student. And access to resources have very specific questions about the different offices that our students frequent most. So it might be CAPS, it might be the care center, the career center, financial aid. And in those questions, we're asking how many times have you, gone to this office? What was your experience? Where you serve? Do you think that the staff in this office is capable to supporting undocumented students? If yes, tell us why. If no, tell us why. If there would be an opportunity to train the staff, what did you want them to know about? And so we're going to be launching that in January, hoping that, our students share, which in my opinion, I think students are really good at sharing when they need support, and I appreciate that. So yeah, that's sort of like how we're trying to close also that gap of cultural competency, because the data will be shared with the partners. And we're hoping that we can also do presentations around campus in terms of like, this is what the students said based on those responses. So how can we become partners or extend our partnership to make sure that we're supporting students in the most equitable and cultural competency way possible?
Yeah, thank you so much, Areli. I'm really glad you brought up the point of data, right? Because people can advocate so much on their own, but then I think leaders and administrators always like to see the proof, right? And sometimes that proof really speaks in the data, and that could help the advocacy piece of it as well. And really just love the point about breaking down silos, creating partners to increase capacity for students. And so I'll turn it over to Dr. Barrios to answer the same question.
Thank you. Yeah, so right, we're often talking about cultural competence, right? And I just wanted to like maybe emphasize like or define, right? Like, cultural competence is a combination of a few things, right? It's the having the awareness of our own biases and perspectives, right? And actively acquiring information about different cultures, and then developing the skills to interact with people from different cultures. And so, yeah, just like Areli mentioned, right, like communicating with the different partners on campus to ensure that they know how to support our students, right? And so in order for a campus to have cultural competency in working with Undocu students, like they have to be aware of the unique needs of the students, like of Undocu students, and how to serve them, right? And so yeah, like financial aid, like that, it's not going to be the same for Undocu students versus general students. I remember a student telling me that they were so grateful that, yeah, like they felt so lost when they got their financial aid check, and they're like, well, what do I do with the check? Like how I don't have a bank account. Where do I? And so connecting, well, with our Undocu student program, that it was like so easy for them to get an answer, right? For like housing and food, right? And so again, what are the unique needs of Undocu students, right? And so some students don't have, so they live in the dorms, don't have a place to go in between fall semester, spring semester, right? Because the dorms close, right? And so elevating that need, like letting people know that this is a need of Undocu students and we need to prioritize this, right? And so having emergency housing and putting Undocu students at the top of the list for having access to this emergency housing, right? Like food. Yeah, they don't have access to CalFresh, right? And so here at UC Berkeley, we have partnering with the Basic Needs Center, the food pantry, and then we have like hot meals for students available on Tuesdays, every Tuesday. And then just like making sure that they know where the Basic Needs Center, how to get there, right? Yeah, legal support. So having partnerships with legal support, and destigmatizing that too, like having conversations, bringing in legal teams or however it might work on campuses, right? And then also, right, so part of being culturally competent and working with Undocu students, say also working with a trauma-informed approach, right? And so trauma-informed care is like having an understanding of trauma and the impact that it has across different settings and services and populations, right? And so you want to take an ecological and cultural perspective and recognize that context plays a significant role in how individuals perceive and process trauma, right? And so we want to minimize the risk of like re-traumatizing students or replicating any like prior trauma dynamics, right? And so when we're working with students in whatever role, right, like we recognize the power that we have in working with students, right? And we want to be intentional about creating a safe place with them, right? And you want to be really clear and explicit about what they can expect from communicating with you, from the relationship with you, right? And what they can't expect from the relationship that they have with you, right? And so in my role, right, like, I mean, all therapists, you have to talk about confidentiality, but like being really intentional about what does confidentiality mean with my therapist, right? And so aside from the basic things, right? And it's also like, so if we run into each other on campus, what's that going to look like, right? And yeah, usually I say like, I'll leave that up to you. I'm not going to initiate a hi unless we're in the center. I'm telling everybody hi, so it's going to be awkward if I don't tell you hi. But yeah, right. And so they know, right? So it's not this shock when they run into me on campus, right? Talking about like, what does documentation look like? Because I have to write documentation for our sessions, right? And so knowing that your status is not going to be part of my documentation, right? And that, right, like I have shared, like your notes are also shared with the health center, right? And but they won't be looking at it. They monitor our stuff, but just letting them know, right? And so maybe thinking about like, yeah, if you're not a therapist, but you're working with a student, yeah, like if you're going to refer them to some other campus department, right? And so ensuring like, do they know how to get there? Right? What's it going to look like when I walk into the door, right? What are the questions I should ask, right? Or if you're going to have a conversation, or you have a conversation, okay, I'm going to follow up with you with resources, right? And so by when can they expect to have that email, right? Or what happens if I don't get the email from you? Like, how should I reach you, right? And so being just really clear, right? And so that it doesn't have to be a guessing game for them, right? And everything, like, this is one way where they can feel more safe, right? Where, yeah, they don't have to be in high alert. And what else did I want to say? Yeah, and right when we're working with students, yeah, maybe sometimes we come up with a plan, right? And they don't follow through, or like something happens, right? And so having a trauma-informed approach is kind of shifting from like, what's wrong with you, to like, what happened, right? And so how, like, yeah, what were the barriers that got in the way from you being able to follow through with the plan that we had, right? And so things feel less stigmatizing, less intimidating, right? And they're seen as a person, right? Like that their humanity is valued. Yeah. So
Yeah, thank you so much for that. I really like that point around not so much like what happened, why didn't you follow through, right? But yeah, the other framing that you also mentioned for it, what's wrong? Yeah. And so yeah, thank you for sharing all of that too. And I think just uplifting the trauma informed approach in this work, and like actually like being communicative of what students can expect in mental health spaces, because I think many in the community have not accessed mental health services. Like they might not know how to move in these spaces, and be communicative of that, I think, can really help with the destigmatization of accessing care. And so I have our next question as well, and we're gonna go with Dr. Moreno Yamashiro first for this one. But what can undocumented student support or student services personnel and administrators do to strengthen mental health support at their campus? Like, it's not just the responsibility of one person, right? But what can the group of folks doing that work do?
Yeah, it definitely isn't one person or one program. Like, it's everyone's responsibility at the college. But one thing that really is telling is what is funded, because funding then provides opportunities. Funding then connects to personnel that can actually do this work. And so, from ways folks can support, like beyond our, like a program, administrators or managers and directors and beyond, is funding these resources, because oftentimes our programs are underfunded, understaffed, right? That's sometimes the theme. And so funding is really, really important to show your support, because most things require money. And while I think it's so generous and so kind of people to volunteer their time because it's hard work, it's so impactful, like I want to be able to pay people. Like this is tough work. It's not easy. So I want to be able to compensate folks. Another way folks could support is, I went to a session recently in the past couple months, and they're like, how are you pitching this to your leadership? And they're like, well, we're saying like, you should help undocumented students, you should help immigration. Like, why aren't we? Like, they're trying to speak to the heart. And I think speaking to the heart is important. And also, when speaking to campus leadership, they want to know additional things besides the heart. They want to know how it's connected to graduation rates. How is it connected to retention? Because those things, especially the California Community College, that equals money. And so we need to speak to the audiences that we're approaching. Some people might need to hear more of the heart and the why, and this is so important. And that heart should always be part of the narrative. And I'm big on that. But in addition, like knowing your audience. Some audience wants to connect it. How is this going to help with our graduation rates, our retention rates? How are we going to get more money by retaining these students, right? And so it's really knowing your audience and tailoring it to it. You can't necessarily have a blanket statement for every constituent group that you're going to, because that may not be as effective as you would like it to be. So I think really tailoring your message to your audience. And in addition to those things, it's diversifying our mental health support on campus. It is a well-known fact that therapists are primarily white women. And so our students are not that, right? Like, we're in HSI, we're in a PZ, we're trying to be a Black serving institution at Fullerton College, and our students are not primarily that. It's actually a small minority. And so working with our office is called Behavioral Health Services. Other offices are CAPS, Counseling Services. It varies by institution, but at California Community College, we're Behavioral Health Services. So it's really diversifying that, because our students need to see themselves reflected, not just in one therapist, like many therapists. Like, we don't want tokenizing to also be happening here. And so again, as much as we could diversify our mental health support, the better we are serving our students, which I know we all want. And lastly, I think it's really removing barriers to the best of our ability and normalizing mental health support. There are stigmas around it. And even though a student may want to seek mental health support, a lot of our services, and every college is a little different, a lot of our services are like, you choose in person or remote. And sometimes it's only a remote options available. Well, guess what? That student who really wants support and is being really brave and courageous now doesn't have a private space to have therapy. And so what I've done is I've worked with our campus partners to be like, where are spaces on campus that are private, where our students can have a private therapy appointment? We have identified them, we have shared them out, so students know, like, if you have a remote or online appointment, like, you can still have it because you may not be able to do that at home. You might be sharing a room with other people. You may have very thin walls, like, and we still want to meet students where they're at and not have them feel like that is a barrier. So like, here we have identified spaces for you. Again, just trying to remove all of those things you all said earlier. Like, what are ways that we could be proactive, right? We know these things exist. So like, how can we navigate our systems to best support our students? So I hope those few things are helpful as we collectively try to do better by our students.
Yeah, thank you so much. I like the practice around providing spaces for folks to take virtual appointments, right? I didn't even think about that, but that could be a barrier and could be getting in the way of folks like accessing those care in the first place. And really just want to highlight the point. I think this works with a lot of things for undocumented student support, but figure out what's important to campus leaders and decision makers and always tailor messaging that way, I think, because that really helps with the advocacy. And so I'm going to pass the same question actually to Dr. Barrios to go next.
Yeah. So I have a lot of the same things to say and when you're advocating, really highlighting like the unique needs of the Undocu student, right? And like, yes. So some of the unique mental health needs, right, for undocumented students is like they have more complex presentations, right? There's typically a history of complex trauma, right? And there's like the financial limitations in connecting with longer term therapy, like, accessibility in connecting with community providers, or safety in connecting with community providers, right? And so the work that I do, yes, the work that I do, my role as a therapist, as a psychologist, is so much easier because of the work that my colleagues do. Like, I'm part of a team, and I know like my role is so unique. But yeah, like the way that the undocumented student program at UC Berkeley works is like they have a holistic approach, right? And and so I'm not having to worry or focus on like meeting the financial needs of my students, meeting the academic needs of my students, connecting them with legal counsel, right? Like those are things that impact their mental health, right? And because I feel really confident in my colleagues that I have, right? Like that doesn't have to be one of the worries that I focus on, right? And I get to focus on their healing, right? And so I encourage like campus leaders, right, to like first ensure that those things are met, right? That students feel financially secure as they can, right? Like that they have their housing, that they have food, right? Because if that's not being met, like of course their mental health is not going to be well, right? And so starting there, like advocating for those parts, and then highlighting those unique needs of the students, right? So that's where you get the money from the donors, right? And then, yeah, being proactive around coordinating support, right? And so, yeah, not every university or every college is going to have that person that's dedicated to Undocu students. And so, yeah, trying to be creative and like, okay, how can we meet the needs of Undocu students, right? And so many folks have talked about like having drop-in sessions, right? And so where are Undocu students meeting, right? And like, can we put a therapist there, maybe to do drop-in appointments, right? To, yeah, like workshops. What are workshops? So like reaching out to the counseling centers in the beginning of the semester, right? And like we know January before inauguration, like that's going to be stressful. So reach out now to CAPS, right? To whoever your mental health unit is and say like, we need a workshop, we need a space, like we need something, right? So before and after, right? And so maybe having, yeah, like, planning for the semester of things that you would like and ask for as much as you can, and then you can see what you get, right? And then what else? Yeah, I mean, next semester we have monthly Know Your Rights workshops scheduled already with our legal team, and then we have a mental health component as part of it too. Yeah, those are some suggestions.
Yeah, thank you so much, Dr. Barrios. I think that was also answering an earlier comment about how undocumented students are just dealing with so many other things that like mental health kind of goes into the back burner, right? They don't have time to think about that. So what are what are the other ways to kind of care for students first, to make room for them to like tend to their mental health as well? And just the proactive support, I think, has been kind of mentioned by everybody as well. But what can be planned now to not make it be so reactive once things happen and we don't know what those things are. But yeah, thank you for sharing that. And so we're running a little bit over time. And so I do want to wrap up with our last question for all three of our panelists. And I'll ask folks to maybe just, I think people had really longer, great answers for this part, but just one quick piece of advice for campuses or organization looking to build or strengthen mental health support for their undocumented students. And we can go in the order that we had on the slide. So Dr. Moreno Yamashiro first, Areli, and then Dr. Barrios.
I'm having a hard time identifying one. So I'm just going to say now is the time. Now is the time. We are in and we will continue to be entering a time where mental health is needed more than ever. If you don't have a plan yet, now is a good time to develop a plan. If there are partners you want to reach out to, now is the time to reach out to the partners. We don't, as mentioned earlier, we don't want to wait. I'm not going to wait. None of us should be waiting. We should be proactive. We know what is coming. And so I would say develop a plan, build those relationships now, or identify whatever is your next step and start that now. So I will pause there because I know we're over time. So thank you.
Areli, would you like to go next?
Yeah, I would say understand the community, right? We are not a monolith, even though we are being oppressed as undocumented people by the system, and function as it, right? Don't take everything that we're saying with a grain of salt because maybe what worked for us may not work at your campus. So you're going to have to do that work in that advocacy. Something that I do is I'm always constantly being the annoying person saying, what about undocumented students? Not to pivot or communities against each other, but more of like, if you're doing needs assessment for this community, we should also be doing needs assessment for our community. And then, yeah, just ask. I mean, I ask all the time and people say no most of the time. And then there's times that it sticks and people say yes. So, yeah.
Thank you. Yeah, Dr. Barrios?
Maybe own your power, right? Like the undocumented student program happened because of student advocacy, student voices, right? And so we don't need to rely on students to make things happen. Like we are in positions that can move things along. We have more power than students do. So let's use that power that we have and like really highlight why it's important, why we need to advocate for undocu students, why they need to be a priority.
Yeah, thank you so much for all that. I hope that folks are leaving with just a lot of great insights. I really want to appreciate our three panelists for not only the amazing work that they're doing on their campus, but sharing with us kind of how to get there as well. I know people are on different like levels of support in general for undocumented students in their community. But know that there is a way to build up, and hopefully you heard a practice today that you're like, oh, that's something that I can do here at my campus or an organization, no matter how big or small it is. We don't have to be, what UC Berkeley is tomorrow, but I think we can think of how can we like expand towards that direction. So also invite folks to give us a lot of, to give appreciations for our panelists in the chat or through emoji or however you'd like to. And thank you all for coming to spend time with us today. And so we are running out of time again as we get closer to the end of our presentation. I'm going to ask Ugo if you can remove the spotlights on our panelists. And I'm just going to go back into our slides to close out the space. And we'll be sharing contact information of all our panelists so folks can reach out if anything after. And so I'm going to go back to our slides. We actually may not have time to do this today, but do want folks to kind of like think about as they're heading out into the space of these questions here that's listed on the screen. What was something new you learned today? What are some challenges that exist in your specific campus or community organization, and what are opportunities as well, and what can you take back from this space today? And I'm going to put that in the chat as well for folks to just kind of think about as they're heading out into this out of the space. If people want to share something in the chat, really invite you all to do that as well. But as we're closing out this space, I do also want to give out our evaluation here. We want to hear how this roundtable went for you, what worked well, what could be improved for next time, and if there's any topics you'd like to see in the future. So I'll give folks a few minutes to actually complete this since this is really important for our team. You can access through QR code or the evaluation link. If Ugo, you can throw that link in the chat as well, that would be appreciated. So I'll just give folks a few minutes to grab those. And we'll also be sharing it in the follow-up email. Thank you, Lisa. I see your comment, growing awareness of needs of our undocumented students. We're not alone, and there's good support to show up and create spaces for our students. Okay, evaluation form is in the chat. Please grab that, open it up. Let us know how the space went for you. And I do want to share, we don't have our schedule ready yet for next year, but we will be hosting more of these promising practices roundtables. In the new year, we're going to be shifting our schedules, so it will be taking place at the third Thursday of each month, same time. But a way to keep updated is if you don't already get our Undocu Digest for higher education. This is a biweekly newsletter I send out every month, every second and fourth Monday of the month. You'll hear about our resources, events, any news, highlights, support related to the undocumented community. And a way to sign up is if you can email Ugo directly at this email right here that we'll also put in the chat to be added to the listserv. And this is a MailChimp newsletter. So if you're having trouble or if you have filters in your school or organization, please make sure to add my contact, Madeline at immigrantsrising.org, to your contacts to be able to receive that. And then let me take a look at the chat. I see there's a couple of things happening there just to make sure I don't miss anything. I see folks, more appreciations for the panelists. And somebody is going to start planning for 2025. So as we know what's coming. And lastly, I do just want to share contact information for all our panelists and also us here at Immigrants Rising. Again, you're not alone in doing this work, and please reach out to our panelists for some additional support as well, or even us as well. This is not the last conversation we're going to have around mental health. And I know Myra also dropped her email earlier in the chat so that folks can also connect with her around mental health work that could potentially be happening in their campus. And so I'm going to stop sharing my screen, but we will be sharing all of this with folks who registered for today. I do want to again thank our 3 panelists for their amazing insights, and hope we can get them back into a space again. I know there's other great work that they're doing, and also just want to thank you all for sharing space with us today. Please be in touch and look out for our next Promising Practice Roundtable and just all our offerings in the new year. So thank you all. We'll see you all hopefully soon. Take care.